Centers of excellence today are really geared around setting us up for tomorrow. And what are we going to do different for the next patient that's going to give us a cure? In 1980, if you had a head and neck cancer, a throat cancer, a jaw cancer, it was enough to be alive. But now, that's not enough. And so we really focus on quality of life.
When I first started in head and neck cancer, we didn't have very good tools to save our patients' lives. I see the Center of Excellence beginning to move towards a survivorship level of programming.
Remember, head and neck is different the way you express yourself. You eat, you speak, you communicate. Taking the tumor out's not enough. These advances in the Center of Excellence have been critical in changing the approach to treatment, but also changing the outcome for these patients.
Our Center of Excellence is part of the Tisch Cancer Institute. We benefit from Tisch's expertise in both clinical trials and basic science research. We specialize in prevention, in the treatment, and in the subsequent recovery from treatment for cancer patients.
My role in the Head and Neck Cancer Center is really bringing all of the specialists together and making sure that the surgeons and the radiation oncologists, the medical oncologists, the speech and language therapists, the nutritionists, we all work together.
Every patient is getting a personalized, multidisciplinary assessment of their needs and of the treatment plan.
Patients walk in at 1 o'clock with a bump or lump in the neck. The biopsies are taken, they're read on the spot, and at 3 o'clock the patient has seen 4, 5, 6 different physicians and surgeons. They have a treatment plan ready to go, and their tissue is already being typed for potential vaccines or immunotherapies.
We put together a program where we use surgery to actually reduce the amount of radiation that patients are getting.
One of the most impactful changes that we've seen has been the incorporation of robotic surgery into the Head and Neck Cancer Institute.
We've been able to actually eliminate radiation therapy for almost half our patients and reduce the amount of radiation that the other half get, and even reduce the amount of chemotherapy going to those patients with perhaps the worst prognosis that we find when we do the surgery.
The procedures are 2 or 3 hours instead of 14, and the patients are home within 2 or 3 days instead of 2 or 3 weeks.
And this is cutting edge. This is not done in most places.
The New York Proton Center is the only proton center in New York State. Proton beam radiotherapy represents the latest and greatest technology that we have to offer patients. If you have a cancer that is sitting near something like your eyes or your brain, where we really need the dose to kind of stop on a dime, that is where protons come in very handy. It really increases our ability to cure patients while decreasing any side effects that may impact their taste, their swallowing, their speech, and their long-term functionality.
If they fail radiation, there's another option for them. To me, that's what a Center of Excellence is. No longer do we look at a tumor under a microscope and kind of decide based on what it looks like. Now we're looking at these things genetically. We're looking at the DNA. We're looking at the mutations that maybe are actionable to design tumor vaccines that 5 years ago weren't available. Tracheal transplantation has been something that has really been the holy grail of airway reconstruction for almost 100 years. The ability to reconstruct, rebuild a windpipe, a trachea, connecting the mouth with the lungs was something that had not been done. And as a result, patients who had defects of the windpipe, and that can be from something they're born with or trauma as a result of being on a ventilator or even tumors, those patients didn't have an opportunity to survive when we performed the tracheal transplantation. We had solved a problem that had been eluding medicine and research for a long, long time. I think it's going to have a tremendous impact on the treatment of patients all over the world. We're not happy and never will be happy with the current status of treatment. It's always about what's next, what's around the corner. What can we provide for our patients that's really going to change their lives and make a positive impact on their outcomes?